This conference will now be recorded.
All right. Once again, good afternoon, good morning, depending on your time zone, and welcome to YALDA October 2021 webinar. On behalf of YALDA International Executive Committee, I welcome you all to today's program. This is YALDA Mental Health Care for All. Let's make it a reality. IT, please, we can proceed with the slide. So next slide.
Can you see the slides?
Yes, I can see the slide. Please move to next slide. Okay, whilst she's fixing the issue, I would like us to observe few etiquettes for today's webinar. When you join us, please kindly put yourself on mute and remain mute throughout the session. Ensure that your camera too is off so that our bandwidth will be stable for everyone. If you have any question or comment, please type it under the comment section. And remember to add your name and your country as well. And those whose questions will be selected, we'll call upon to respond, to ask your question once again after the plenary session. And you require to repeat the question and mention your name and your country as well. IT, please, can we? All right, I think. Okay, so Moses Adena is my name. I'm your moderator for today. I'll be introducing our speakers, those who will be on our plenary session. We have Busile from South Africa. She is a counseling psychologist. For the sake of time, I'm not going to read the profiles. I'm just going to mention their names and their titles. So let's proceed to IT. We have Grace. He's a licensed clinical psychologist from Uganda. He's one of our speakers. You are welcome if you are on board. Let's proceed. We have Edina. She's also a psychologist and founder and chief well-being officer of Active Wellness. You are welcome. We have Ali Salama. He's a founder and CEO of Empower Magazine. He's from Egypt. We have, please forgive me if I'm not able to pronounce your name well, and you can do so when you take the floor. We have Ongbo Pose. She's a founder of the Pocket Coach from South Africa. All right, before I will read we will proceed to the plenary session. I would like to give a brief intro of what today's webinar entails. And oh my God. Sorry, I have some technical. All right. Perhaps the most stigmatized and controversial subject in Africa is mental health. One of the many overlooked obstacles Africans face, mental health related issues reign as consistently ignored topic among the 1.2 billion people on the continent. The World Bank considers mental illness the greatest thief of productive economic life. 85% of people who suffer from depression on the continent have no access to effective treatment. This number is even higher for more acute mental illness. With the world fighting against a global pandemic, mental health and psychological support has increasingly become a key component of the COVID-19 response. The World Health Organization reports that there's an increased demand for mental health services, yet in Africa, most governments devote less than 1% of their budget to mental health services. There are only 1.4 mental health workers per 100,000 people as compared to the global average of 9 per 100,000. Evidently, there is a large void in the African government expenditures where mental health is concerned. Because of this, it is important that we consider how the concentration of services in the private sector affects those unable to access essential services. YALDA recognizes the silent suffering Africans endure because of the lack of attention being placed on mental illness. During this webinar, we intend to highlight the importance of discussing mental health and why providing adequate mental health services benefits not only the well-being of Africans, but also the enhancement of the continent. So we'll quickly move to our plenary session whereby our speakers will respond to the same question. They will share their knowledge and expertise with us on the same question. So please, IT, kindly project the question so that the speakers will get acquainted with it. Yes, so the question is in many folds. So in addressing the topic, please ensure you cover all the questions. It's a bit long, but please forgive me. In Africa, most governments devote less than 1% of their budgets to provide adequate mental health services for their respective citizens. What is the significance of this data? How does it highlight the lack of attention paid to Africans suffering from mental disorders? And where does the stigma that is attached to mental health, specifically by Africans, stem from? Could this low number of be the byproduct of the stigmatized topic, or does the scarce access to professional services perpetuate a cycle of undiagnosed and uninformed youth? So as you can see, the question is in folds. And my first speaker to respond to this will be Busiele from South Africa, founder of Resadi Mental Health Association. So please take the floor and kindly mention your name well to us, and sorry for mispronouncing your name. Thank you.
Thank you so much. Very good morning, afternoon, and evening to those who are joining us on the platform today. My name is Buisile Mngina, and I am a counseling psychologist as well as a co-founder for Ribasadi Mental Health Associates. I'm also a sessional lecturer of psychology at Wits University here in Johannesburg. once again want to extend heartfelt gratitude for joining us today as we unpack a very important subject matter around mental health care and access. I will be glancing away from time to time as I pace myself with the question that has been rendered to all of us so that I am able to speak in line with what has been advised. The first point of departure, of course, is talking about the statistical representation of the awareness of mental health by our government, our stakeholders, by the macro system, if we're to take on an ecological model. Yes, indeed, we see less than 1%. In South Africa, we see anything reported between 3 to 5% of the budget that is allocated to or dedicated to mental health services. This, of course, is very discouraging. Particularly because the numbers are significantly low, yet we understand that if we are to look at occupational wellness, or to look at personal versus career balance, we know that the backdrop of a successful candidate, of successful people in the workplace, does include mental health, it does include awareness, it does include support, and to see that at a systematic level, there is a disregard or at least a slow appreciation of mental health, we then realize that we are certainly edging on very challenging matters. We are certainly edging on a situation where we will find ourselves with people who have been disenfranchised. We'll find ourselves with individuals who have been compromised significantly because of the lack of establishing some kind of mental health balance and awareness. Now, in terms of the significance of this very low number, we do know that, of course, it then translates into support for interventions and spaces as well as organizations that would like to prioritize mental health. If it is not something that is tabled as a priority in the agenda, then we find that it is very difficult for it to translate into actual field work representation of mental health being able to be grounded, rooted for and by the African people. So when we then extend from that, we then look at the attention paid, and if this is not linked to significant stigma. The very important thing to consider is that we are speaking from an African context, and African contexts and interventions are best realized or rolled out in the context of a community. So in the absence of dedicated interventions that are community based and community focused, what we will then realize is that we will keep spiraling under the assumption that we are still behind, we have not been psychologized, that our communities still underestimate therapeutic interventions, that there is a lot of stereotypical or prejudicial projections around mental health. The most common that we often see, even in media platforms when we're talking about access, is the assumption that many people would associate coming into care, accessing care, particularly in therapy and psychology, as a representation of significant dire mental health issues, being, for the lack of a better term, disoriented, not being okay, being mad. It's only reserved for particular gender or race or age or class dynamics. But we're also finding that there is a keen awareness of mental health, the need for mental health. What is the challenge is, what does it mean to access mental health well? What does it mean for us to have sustainable practices around mental health? What does it mean for us to have subsidized initiatives and interventions where we can find ourselves as private practitioners, where we can find ourselves as community intervention strategists being supported significantly in order to roll out mental health care. So we certainly need to shift and move away from wanting to scapegoat the person and scapegoat the community as not being willing to access care, and really look at the complexities of what does it mean, what does it translate to religiously, spiritually, what does it translate to financially, and are we able to support the person more broadly from a biopsychosocial approach. So when we look at perpetuating the cycles of undiagnosed and uninformed youth, can we really say our young people are uninformed in a tech era, in a social media era? I think what we are seeing emerging, particularly with adolescents, is that there is a sense of being able to harness and understand and use psychological language quite well, quite proficiently, quite precisely to what they are experiencing. We no longer have youth in crisis when it comes to being able to name and associate their internal experience. What we do, of course, have is a mental health care system that is potentially lagging behind highly aware clusters of young people in our time or in our era. What we do understand is also that there is the sense of an intergenerational appreciation of mental health, where parents who are of an older generation or other extended members and grandparents are able to acknowledge and appreciate that they too are coming into a space of learning. They also appreciate that the manner in which they have been socialized is completely different from all of the ways in which young people are adjusting to mental health in the present day. We know that in terms of understanding what a person is going through, we do find a lot of people who at least have some kind of unaided or poorly guided diagnosis, where we see a lot of people self-diagnose because of the benefit of the internet and because of the benefit of searching through. So when we are looking at all of these complexities, very important for us to take on an ecological model that moves from the individual outward, so that we do not place the complete responsibility on individuals in terms of them accessing care, but we also need to understand that there are certain ways in which we have to empower the person to be able to engage a sustainable practice when it comes to health seeking behavior. I think that would be the place where I would like to punctuate my thoughts, and I will engage as the panel also expands.
All right. That was awesome. Thank you so much for sharing your thoughts with us. I hope our participants are taking notes so that you can also share with your network. All right. So quickly, I'll be moving to our next speaker to respond to the same question. If you have just joined us, please put your mics on off and your cameras as well, so that the bandwidth will be stable for all of us. Yeah, thank you. So next is Grace, a licensed clinical psychologist and mental health specialist. Please take the floor.
Thank you so much. Hope I'm loud and clear. Grace,
yes, you are loud and clear. Yes,
oh, okay,
you can put on your camera so that we see you. Thank you.
Okay, thank you. Once in a while, I'll put on my camera and have a glance with me. So, dear colleagues, good morning, good afternoon, and good evening, everyone. Nice to meet you here in this good topic about mental health. Right now, I work in Uganda. I'm a clinical psychologist and addiction specialist and a global master trainer with UNODC and Colombo, Sri Lanka. That is the Colombo Plan Advisory Projects. I work in the National Referral Mental Hospital, Butabika, which is a national referral for the mentally ill in Uganda. And I'm also a lecturer of psychology and clinical issues. So regarding the issue and regarding the topic of mental illness, I know this is a very trending topic which has been on. in the past weeks when we are celebrating the Mental Health Week. As my friend has been sharing, a lot of stigma, a lot of misconception, a lot of perception is surrounding mental health. Right now, as I speak, I even work on a Saturday, on a weekend. I'm in my office. I'm from seeing a number of patients where we are overwhelmed. But significance to the data, as it was recorded, I know you are very aware that according to the global health, as you said in the article of mental health in Africa, the weakness of continent mental health service, there is 1.4 mental health workers per 100,000 people, as you mentioned it very well. The region also performs relatively poorly. If you go into the data, on the number of psychiatrists, number of clinical psychologists, a number of other mental health workers, actually the number of hospital beds per patient with mental illness, coverage of outpatients for mental health is extremely low. So there's a lot, and the governments in Africa put in a little budget, literally 1% per se is the budget that is put into mental health in Africa. I was looking at different examples. For example, mental health problems appear to be increasing in importance in Africa. I think we are very aware in that with also the ongoing pandemic, the COVID-19, there has been increase in mental breakdown, there's been increase in psychological issues, with also many, for example, the youth are experiencing a lot of psychological problems as they have failed to realize their ambitions. And some have turned into substance misuse. And this, in the meaning, it's because of elevating their frustration. So there has been a lot of increase in mental illness, but vis-a-vis, there's a lot of increase in stigma. People fear to approach mental health hospitals. People fear to go to mental health centers, but also due to the ratio. I'll speak with evidence. Where I'm working right now, the number of patients we have an inpatient, this is a national referral mental hospital. The ratio of clinical psychologists to the patients is overwhelming. We have over 900 to close to 1,000 inpatients. And then the ratio of clinical psychologists, the hospital only have about 3 clinical psychologists. The psychiatrists are very few, and also the psychiatric nurses are very few. So the budget which is put into mental health is very small. And all this has created a very, very big gap in Africa. Mental health is not funded like other projects. I think, bear witness with me. More projects are funded, billions and billions of money, but our governments have possibly not put much emphasis on mental health. Bit Uganda, bit Nigeria. I think Nigeria, there's so many psychiatric hospitals. They have tried. I was in Nigeria. I've tried so many times in Nigeria, in Abuja. I've tried those psychiatrists. I think for them, they have tried a little bit. There's so many psychiatric hospitals currently in each state. I think there's a psychiatric hospital. But you find some countries in Africa, there is only one national referral hospital, and there are no other hospitals. So ignoring mental illness has wide-reaching impact, friends. Beyond the individual experiencing it, I don't know if we are all aware about this. In Uganda, for example, and Zambia, take a case. We see women impaired ability. We see women's impaired ability to function day-to-day life creates profound hardship because so many women have been diagnosed with depression and other mental-related disorders. When a woman is unable to perform, for example, what will happen? Her essential social responsibilities, she can become a target of criticism and exclusion. I mean, an African woman with depression compared to her health peers suffers greatly. She is less productive and she is a mother. The negative impact extends far away even to the to the society, extends to the family, and extends to other members of the, of the community. So what do we mean here? It has been quite a big trend where mental health has been stigmatized. And where does this stigma stem from? If I'm to refer to a question, I believe lack of awareness. So many people are not aware about mental health. There is lack of education on issues and perception regarding mental illness. Take a note, those days, people would be tied on ropes at home. There is stigma. The family doesn't want to associate with a person who has got a mental problem. How does this happen? Some mental disorders, as we are aware, some of us here, I'm sorry, we are not into mental health classifications, but as you are aware, some mental disorders are stigmatized. I mean, people feel they are stigmatized. Why? Because of the odd behaviors that these patients present with. For example, take a note of mental illness like schizophrenia. When a patient undresses, when a patient puts off all the clothes, a patient stands in the road, but this patient is unaware of what is happening. But with the people around who are mentally okay or whose mental health is fine, they get stigma because of the odd behaviors being shown or presented by the individual suffering from mental illness. So the nature and complication of the mental illness itself, trust me, so many Africans are battling with mental illness, and the nature matters. The class where someone is coming from, some people fear to be associated with mental illness. I mean, we are in the community, and in our communities in Africa, people take mental illness, people even refer to it as madness, which is the context, which is a word we literally don't use in mental health setting. People say madness. I don't know in your local languages what people call these people. In our local language here, it is a very bad word that people refer to a patient or a client suffering from mental illness. So this stigmatizes the community. This stigmatizes the people who are having this patient with mental illness. So what is my take on here? Although the quality and effectiveness of mental health services has somehow improved, therapeutic revolutions, in psychiatry have not yet been able to reduce stigma. So we have a very big gap in Africa. My members of YALDA here,
Mr. Very big. A small interruption. Kindly summarize towards end. Thank you.
Okay, yeah, I'm trying to summarize. We have a role to play. So stigma originates from multiple sources which work in synergistic manner and have serious implications on individuals. It has implications on individuals' life. This may be from personal, social, family, and the nature of illness itself. So my colleagues can add on from there, but we have a big gap to address in Africa, and the stigma is too big for our people suffering with mental illness. And the government should really put in money and a lot of awareness. Thank you.
All right, thank you so much. Grace, if you have just joined us, that was great. He is a clinical psychologist in Uganda. Thank you so much for sharing your thoughts with us. Fast forward, we'll be moving to our next speaker. And before you take the podium, please put on your camera so that we can see you. So we are moving to Ali Salama, founder and CEO of Empower Magazine. So please respond to the question.
Hi there.
Thank you. Yeah.
So in Africa, most governments devote less than 1% of their budgets to provide adequate mental health services for their respective citizens. What is the significance of this data? How does it highlight the lack of attention paid to Africans suffering from mental disorders? And where does the stigma that is attached to mental health, specifically by Africans, stem from? Could this low number be a byproduct of this stigmatized topic, or does the scarce access to professional services perpetuate a cycle of undiagnosed and uninformed youth? I think
Yes.
this question is
Just a small interruption. Please, you can type your comments and questions under the chat section. We will be picking some for the speakers to respond, so you can do that. Yeah, thank you. Proceed, sir. Sorry about that.
no worries, absolutely. So I think you know, with the government spending very, very, very little on mental health, you know, it's of course a natural byproduct to see very, very how would you put it? Like, it's just I believe that this forced expenditure will of course have ripple effects on the level of education and psychoeducation young people have, and especially in the time that we are living in right now, where we need to be aware of certain things that happen psychologically, because the state of the world is going through a very huge trauma, and that is the COVID-19 pandemic. So those who aren't really well aware of the mental of their 101 mental health or mental health 101 behaviors, it will kind of take a big burden on the healthcare system, because psychosomatic symptoms develop. There are so many effects that have a ripple on effect on young people especially. So I do believe that we definitely need to sort of pay attention to that. But I also think that, you know, from a stigma's perspective, I think that the stigma is attached by historically speaking, you know, I mean, speaking about Egypt, at least when we were colonized, it was, you know, I definitely do think that the hysteria around the things that we couldn't see, and that was anything from, you know, mania disorders or anything really that presented a danger, and I say danger with a paraphrase here, to an average citizen that has no idea on what effects a person could be experiencing mentally on the adversary. So I think that historically speaking, the stigma has been attached in Africa for quite a long time, and I think that it hasn't really been supported by the rapid how could I say, the rapid adoption of technology and the rapid adoption of the innovative solutions that we're getting in every other industry. So I think that what we're seeing right now is we're seeing a lack of access to well-being professionals in Africa. We're seeing very little affordability from people who need it most. So those that even have access to well-being services, whether it be through digital means or whether it be through a physical and digital means, a hybrid mean, I think that isn't representative for especially the young people in Africa that need the support the most. But also the largest thing, and I think that's the biggest sort of challenge here, is the navigational component. Where do we go when we're struggling? Because I think that for many people, you know, a statistic like this, 1% of the budget is spent on adequate mental health services, is very reflective on the tolerance of mental health in the society in African cultures. So people don't feel even safe, and I speak, you know, especially with a lens looking from Egyptians or an Egyptian culture, so a North African culture side. That isn't really accepted, or there isn't really much discourse in North African homes around mental well-being. So where do people go? And I think that is a very important question that we need to ask, because people go places, and if we want to empower those young people to live a better quality life, to be better, producers for their economies, to actually become much more functioning citizens, then we need to really put more attention onto where we can solve the burden of mental well-being. But I think that would be my answer for that question. I'm more than happy to take any questions in the chat.
All right, Ali, that was snappy and awesome. You actually addressed a lot with that short time. Thank you so much. As I stated earlier, you can ask your questions or comment under the chat so that we can pick them up. So we have time for that session as well. So if you have just joined us, this is YALDA October 2021 webinar on mental health. Thank you. So I'll be moving to our next speaker, Edwina. She is a psychologist and founder and Chief Well-being Officer of Active Wellness. I didn't say this earlier. Every speaker has about 5 minutes to respond to the question. Thank you. Please take the podium with your camera on.
Edna is currently joining right now, so if we can give like 1 minute maybe for her to get on, that'd be perfect.
You are not audible enough. Please speak a little bit louder. Thank you.
Oh, I said Edna is currently joining right now, but we're gonna move on.
Okay.
And then we will come back to Edna.
All right. That's fine. That's fine. Okay, so we have this founder of the Pocket Coach. Please take the podium with your camera on and respond to the question. Remember, it is in several folds.
Hi, everyone. I'm not sure if my camera is on yet. Okay. Yes, so I think, it's a very complex question, I would say, and probably has various parts to it. I think I won't repeat what has been said by a couple of my colleagues on the forum, but I think it's important to also contextualize that it is a global, the extent of the problem is also global, right? So if you look at that statistic that says, 1%, African governments spend only 1% of their total government budgets on mental health care provision. The context is that the WHO did a report, I think last year, and they found that on average, governments globally are only spending 2% of their government expenditure on mental health care provision. So I think it's also important to contextualize that it's a global issue. And just to touch on that, I think what's also important is that the question was around, what does this data tell us about the extent of the problem, or at least the appreciation for it? And from my perspective, I think what's quite clear is, I think people are aware of the extent of the problem. In the age of digitalization and information age, you have, it's very easy for people to see statistics and access data around mental health care issues and how they're affecting people across the continent and the rest of the country quite significantly. But I think what the issue is that there isn't an appreciation for the urgency to drive to action. And I think where that stems from is really making these statistics real. So how do you really communicate to policymakers, decision makers, both in the private and public sector, how real the problem is? I think I came across a statistic in building the Pocket Couch, which I'll touch on later, which says that suicide is the fastest growing and second leading cause of death in the age group 15 to 29. And I think a lot of people are not necessarily aware of what that means, and let alone the statistic in and of itself.
This is a small interruption. Please, if you are not presenting, please put off your camera and mute your mics. Thank you.
Sure. So I think it's an appreciation for the urgency of the problem, which is where the gap potentially exists. And so how do we make the numbers more real for the audiences that are well equipped or equipped to make decisions and change at scale? Then I think the question around the lack of provision of psychological service providers at scale is something that definitely contributes to and exacerbates the problem. A couple of my colleagues on the panel touched on the very significant point that the psychological support system, if you will, is ill-equipped to deal with the extent of the problem, right? So in South Africa here, for example, you have a ratio of, say, 1.5 psychosocial providers to 100,000 people in the population, whereas comparatively in the States, that number is about 10.5 to 100,000 population. So one has to kind of take a step back and reflect and say, so what, in the context of the fact that there isn't enough supply and there is this burden of a problem, how do you come up with innovative models to address the problem? And somebody mentioned on the panel earlier this evening around digitizing, virtualizing mental health care help. And I think more emphasis needs to be placed on how we do that, right? Because what then happens is twofold. So one, you're able to leverage efficiencies that come about as a result of digitizing access to mental health care resources at scale. So a provider, perhaps who's sitting in Johannesburg, South Africa, can service, who is perhaps underutilized in terms of capacity, can service somebody looking for help in Harare, for example. How do we really innovate around models that make mental health care provision accessible through digitalization and innovation? I think just my last point around, we touched a lot on stigma, so I won't labor the point around stigma, but I think there is something that is quite poignant around the ease with which you're able to find help and how to address that too. So I think, having had personal experiences with mental health issues and with all the access to information, to some extent it is overwhelming. So how are we thinking about simplifying the journey to get help? If in the event that I have an inkling or my instincts or my knowledge is telling me that perhaps I might need help, where do I go? And how do we simplify that journey? So stigma, of course, is a very significant proportion of the problem, which creates an impediment to access. But how do we make the journey simpler, faster, and more convenient for people looking to get help? So those are just some of my reflections based on the question that was asked, and trying to kind of give my perspective around other answers that were given. Thank you.
Thank you so much for your contribution. Please, Alfred, please put off your camera. And if you are not presenting, please put off your camera. If you're not presenting, please put off your camera and keep your mics mute. And you can type your questions and comments under the chat so that we can forward them to the speakers to respond to. So please do that. Alfred, I'm still waiting for you. Put off your camera so that the bandwidth will be stable for all of us, especially those who have poor internet connection. Thank you. Fast forward, we are moving to our next speaker, Edna. She is a psychologist and founder and chief well-being officer of Active Wellness. Please take the podium and put your camera on.
Hi, I'm sorry I'm a bit late. I mixed the times here, so
Just a small interrupt. Please, IT, can you put off Alfred's camera since he's not compliant to the ethics? All right, continue. Thank you.
okay. So I'm here. Thank you for inviting me. I have the first question, or the first topic I'm going to talk about is with regards to Africa's budget on mental health issues, and what is the significance of this data. So in Africa, most governments, they devote less than 1% of their budget to providing adequate mental health services for their citizens. And what does that mean? And what that means for people suffering from mental disorders and issues regarding stigma. So I believe that this data simply tells us that we still have a long way to go. So we know that neuropsychiatric conditions, they account for 13% of the global burden of disease and over 5% in Africa. This is from WHO, and this source is dated to 2008. So I believe the numbers have increased now. So we know that there are really compelling arguments that neglecting mental health will make it extremely difficult to attain many targets in Africa, such as sustainable development, goals related to poverty, HIV, malaria, gender empowerment, and education. So the numbers per se, they gives us an idea about society, governments, of people, how they see people with mental illness. And sadly, many patients, they do not only cope with the devastating effects of their illnesses, but they also suffer from social exclusion and prejudices. So these individuals, they are still put to the side as if they have and or will not have anything to contribute to society. So due to their condition. So if we talk about stigma regarding mental illness, this is a very old subject. This is dated for ages. So this is an old reality, not just in Africa, but around the world. For instances, persons suffering from depression, autism, schizophrenia, and other mental illnesses, they are not better treated than slaves or criminals olden days. They were imprisoned, they were tortured, and they were killed. So in the Middle Ages, there were this idea that mental illness was a punishment from God. So sufferers, they were thought to be possessed by the devil, and they were burned or at the stake and thrown in prisons and madhouses where they're chained to the walls or their beds. So we still have this reality, I believe, in many places here in Africa. So while other continents, they have made their own progresses in regards to mental illness, I'm not saying that stigma they have all like got rid of stigma, but they still really far ahead from us. So in Africa, we are still way behind. And stigma attached to mental health issues in many African countries is still highly negative and often mythologized. And in some cases, people with severe mental issues are suspected of being witches. We still have this reality, and I'm going to talk about my country, which is Angola. So we have people suffering from mental health who are believed to be witches or to be possessed by evil spirits. And this opens the door for religiously run myth-based prayer instead of people getting appropriate mental health care. They are taken to churches. They are taken to priests who can pray and get rid of the devil, and that really worsens stigma, and it can also worsen their conditions. So we have the stigmatization of mental illness is still an important societal problem. The general population is largely ignorant about this problem, and fear of the mental ill remains prevalent. It's common to see in the streets people running away from mental ill individuals because the stigma attached to them is of they believe that they are violent, that they are crazy. If you pass through them, you're going to be beaten, you're going to suffer some kind of attack. So it is a reality, and it is really sad. So although we no longer like imprison or burn or kill mentally ill people as in the Middle Ages, our social standards and our attitudes are nonetheless unworthy of modern welfare states. So we still have this structural.
Edina, you should be summarizing now.
Sorry?
You should be summarizing now. Thank you.
Okay. So I think that this low number is due to a mix of things. So we have the issue that our governments, they don't see mental health as a priority subject in their agendas. We have lack of knowledge about the mental health impacts on people's functioning. We have lack of data. We still need to run lots of studies in order to really perceive the numbers of mental health, of mental ill individuals in Africa, so we can tackle the issue, so we can convince the governments that this is real, it needs to be tackled, it needs to be taken care of. So we still need also to fight the stigma. And in order to do so, we need more advocates. And to have advocates, we need more mental health professionals. We need to raise awareness on the subject. We need to make mental health a household topic. So we have a long way to go in order to have more money allocated in a subject of treatment of mental health conditions. So the movement, it has started. It's still really low, but I believe we just need to keep talking about and making studies, and I don't know, getting attention from the government.
Okay. All right. Thank you so much, Edina, for your contribution. That was awesome. You made a very important revelation about people associating mental illness with witchcraft and other stuff. So maybe our next webinar should focus on how cultural and religious beliefs impede the fight against stigmatization of people with mental illness. Thank you so much for your contribution. We are moving quickly to our next speaker on the panel to address the question. So participants, you can type your questions under the chat or your comments for the speakers to address them. Maybe if you're asking question in relation to a particular speaker, please make reference to that and add your name and your country. Thank you. Okay. All right, so I think we exhausted that. So we'll be taking the specific questions to specific speakers. So we are starting from Mr. Ali. Please take the floor.
So, okay, I'll just read this the question out so everyone's on the same page. In an interview with the National News, you described your podcast Empathy Always Wins as an intersection between mental health and leadership. As a young ambassador of the Middle East and North Africa region, who is vocal about personal bouts of depression and suicidal thoughts, what advice do you give other young Africans attempting to become leaders but finding it difficult to do so because of the mental illness they face? How can one identify when they must put their mental health before striving for success, and what are the most beneficial resources to do so? I think that's a very loaded question.
Okay. Please, before you proceed, just a small interjection. We will be happy if you can just proceed without reading the question. And under this session, please, you have 3 minutes to address your question. Thank you. Summarize as possible.
Absolutely. So, in just a very brief summary to the question, I think that there can exist, leadership cannot exist without great well-being or great mental well-being. So for me, it's about being it's about cultivating the skill set of emotional intelligence and empathy in young individuals, and that will enable sort of the entire team to feel more connected, to be able to embrace vulnerability, and thus to achieve the level and targets that they want to achieve. I think that it's very difficult to bring the idea or the conversation around mental health in the workplace because of all the stigmas and the challenges. But I do believe that if we enable young people to have much more awareness, self-awareness, entering the workplace, and if there are more activities within companies that revolve around leadership from the emotional intelligent perspective, then we can narrow the gap a little bit between well-being at the workplace and people striving for those leadership, young people who do face illnesses, myself being one of them, that are able to be vocal without having to fear that stigma, by actually embracing a little bit of vulnerability in their work. And that, I think there's so much research out there. Dr. Brené Brown is one of the leading researchers in the world, and she her work can really talk a lot more about how embracing vulnerability has a clear cutting edge, whether it be through creating art in the workplace, just as an individual in general. But I hope the answers helps.
Thank you so much for your contribution. That was snappy and succinct. All right, so fast forward. Our next speaker is Edina, and this is your question. As one of the many business owners on this panel, widening the scope of mental health services in Africa, what are some of the most impactful developments you have noticed while providing accessible health to mental health? How is this seen in the workplace, schools, and what can offering a safe space for people to discuss their struggles mean for developing a more resilient and self-aware population of African youth? So please, under 3 minutes, please respond to this.
So one of the most impactful developments is seeing people talking openly about mental health issues and taking care of their mental health. So we also have clients that were on the verge of developing certain mental health conditions, getting in touch because they took part of a workshop or of a training in which we presented the signs or symptoms of this or that condition, and they could get, due to that, they could get the help they needed due to our work. This is really fulfilling. And so at the beginning, we see people a bit shy, but with time, they start engaging with us. People are starting to talk about mental health in workplaces. We are not used to it, but they start realizing that it is important to raise awareness and to pay attention to employees' mental health and well-being, as their engagement and productivity depends largely on their mental health state. So providing a safe space for people to discuss their struggles is the key to developing a more resilient and self-aware population of African youth. So by doing this, we are informing and we are fighting the stigma, and we are making a greater movement to so that our government start to allocating more resources in tackling mental illness. So those are some of the developments we are starting to see, and we can see that young people, they are joining this movement even here in Angola. So now we have the technology, the boom of the technology is making things like easier. So information can be shared more freely, and if we, of course, if we pay attention to informed and with from real and trusted sources, we can help and work with young people in making mental health something important to talk to and to take care of. So yeah, resuming, this is my answer to the question.
All right. Thank you so much for your response. IT, let's move to our next speaker. All right. So to Ongo Poste, how can a mental health platform as a pocket coach enable those uneducated about the mental disorders they face find the proper care? How will the rise of services such as the pocket coach revolutionize mental health in Africa and remove the hesitancy some people may experience when searching for resources for help? Please, under 3 minutes, respond to this question.
Thanks, Moses. So just for some context, the Pocket Couch is a online mental health care platform that connects people that are looking for psychological services with vetted and trained psychosocial providers. And so the first question around mental health care education is that while that is the main value proposition of the company, companies like Pocket Couch, there are also three other very important things that we're trying to achieve. And the one is creating virtual communities where people can tap into resources and content, which is vetted, of course, and which comes from experts. So one of the things we're trying to do is really make sure that information and educational content is not only legitimate, but is also digestible for audiences. Oftentimes you find it very difficult to understand certain nuances around what mental health issues are and how to address them. So in educating people through creating virtual communities, by making content more digestible and relatable for the intended audience, and also by innovating with techniques like gamification. That's how Pocket Couch intends to create more awareness around mental health care education. The second question is around revolutionizing mental health care provision. So I think it's no secret that telehealth and telemedicine are disruptors in and of their own right in the medical sector in general. And COVID has really shown us the power of virtualization. So I wouldn't be surprised if there's an advent and a significant increase of digital platforms like the Pocket Couch that are really trying to connect people with the help they need. And I think the goal in terms of disruption is really leveraging, how do you leverage digitalization and innovation to make mental health care provision more cost efficient, more effective and convenient to access? And also, how do you make it private? I mean, stigma is obviously one of the things that we touched on. If people are able to access mental health care services wherever they are in the comfort of their own homes, etc., you really begin to privatize the journey a lot more, which perhaps could solve some of the nuances around stigma and getting access to help. So that's my perspective.
Okay, thank you so much for your response. IT, next slide. Okay, so this goes to Grace. Working with substance abuse patients must present specific challenges. What approach do you take to your counseling, since, as previously stated, there are significantly low government expenditures for mental health services? What are some of the glaring and obscure signs of substance abuse and mental disorders that can be seen in African youths? And at 3 minutes, respond to your question. Thank you. Put on your video.
Sorry, I beg to see the question again.
All right, IT. Please project his question.
The question again.
All right. Can you see that?
Yeah.
Yeah. So the question, the focus is, what are some of the glaring and obscure signs of substance abuse and mental disorders that can be seen in African youths? And what is your approach to counseling? I think these are the focal points you should be looking at.
Okay, so yeah, I think mostly the approach depends. If you're working with people with substance use disorders, but also to really appreciate that someone is having substance use disorder, it depends on the assessment, and of course, some people are social users and some people are addicts. So in order to know that someone has a substance use problem, we literally do an assessment. A patient sits with a clinical psychologist, a psychiatrist, and then we do an assessment. And then that assessment informs us or if someone has substance use disorder. But in most cases, we use the DSM-5, which is a diagnostic statistic manual that has different criteria. So when someone meets those criteria, which I may not mention now because of time and because of different expertise on the platform, if someone meets those criteria, then we say this one has substance use disorder. On the question of how different approaches, of course, different approaches are used in different individuals and different cultures. For example, here, the approach we use is mostly outpatient and patient treatment, but also voluntary and involuntary. Meaning that with someone to get better of addiction, it doesn't mean that treatment must be voluntary to be successful. I thank you.
All right, thank you so much for your response. IT, let's move to next slide. Okay, this question is for Baisle. Please, your question is, given your expertise in psychology and seasoned communications and media background, how has mental health been represented in the African media? Does the narrative of mental health affect the amount of African youths who take mental health seriously?
All right,
Please,
thank you
under
so
3
much,
minutes,
Mike.
respond to.
Thank you for the question. In terms of what we see, I think there has been quite the effort, particularly in South Africa, where you have seen many platforms really try to appeal to adolescent health as well as mental health. You do find programs, after school programs that would run on TV, as well as some conversations that are held via radio, where we start to engage some of the experiences of adolescents, but also equip parents in terms of how to manage their own mental health as well as how to support the mental health of their adolescents. In terms of social media, there's also significant effort being put out. There's also the call, of course, for more work to be done, more spaces that are quite supportive of youth experiences and really do encourage a sense of being able to support young people. So in terms of what is out there in the media, be it with print media as well, in terms of magazines, we do find that there is an effort to be able to acquaint young people to their experiences. What do we speak about when we are zoning in on, stress, anxiety, depression, body dysmorphia, etc. And all of this, of course, aligned with the DSM. And of course, there's a call for more. I don't think we can ever come to a place where we can say we have been exhaustive in interventions that are fostered towards mental health care. There's significant work that is yet to be done, and of course that we would appeal more to young people, that we would go into their spaces and find out equally from them what they would like us to zone in on, what they would like us to expand on in terms of catering to their mental health.
All right. Thank you so much. That was awesome. Please, IT, take note of the questions and comments under the chat so that you can sample some of them for questions and answers. So you can sample some of them, and if you can project them, that will be fine. If you cannot, take note of their names and we call them out to respond.
Hi. So
Maria, can we hear from you?
yes, can you hear me?
Yes, we can hear you.
Okay. So the first question we have here is from Dagmawit Asiga. Would you like to say your question, or I can just read the question for you? So they say, can mental illnesses be prevented or avoided? And Dagmawit is from Ethiopia. And these questions are open to all of the speakers. Thank you.
Okay, so our speakers, if you would like to address the question, please raise your hand. Do we have that option? Okay, so I will randomly call the speaker. So I would like Edna to address this question. Thank you.
Hi, the question is if mental health can be prevented, mental illness.
Yeah.
Okay, there are many factors that play a role in whether people will have mental illness or not. So we have to take into account genetic environment and even personality and other physical health conditions. So we can take actions in taking care of our mental health, living a healthy life, taking care of our resiliency, our way of thinking, and many other things, kind of our self-care, having healthy relationships, healthy nutrition and everything else. But if and my colleagues, they can agree with me. So, but if you have these running in your genes, or if you are put in certain really difficult life situations, you will still develop a mental health conditions. So we can make efforts to live a healthy life, but there are many things that will take into account in whether you will develop a mental health condition or not. So we can do everything to prevent, but if I don't know, if those other things happens to you, you can or not develop a mental health condition.
Okay. All right. Thank you so much for the response. I hope your question is answered. And let's proceed. If we have more questions, maybe we should take 3 of them and proceed to close. We are far behind time. I think we have only 12 minutes left.
I see Zabiba of Ethiopia, and her question is, what do you think is the cause for giving less attention towards mental health? Adding on to this, do you think matters of priority made it to be given less attention? Also the factors, ooh, I just lost her question. So we can just answer from that because the question is lost now.
Please, can you take the question again?
Yes. Yes, it is. What do you think is the cause for giving less attention towards mental health? Adding onto this, do you think matters of priority made it to be given less attention? Also, factors that cause mental health somehow are economic and social situations. Can we say addressing socioeconomic issues could potentially help to address mental health indirectly before it happens?
Okay, I'm giving this question to Baisile to respond. So please kindly put on your camera and respond to this question. Thank you. Under 1 minute, preferably.
Yeah, I think in terms of the lack of initiative, I'll call it lack of initiative, because in terms of the awareness of the importance of mental health, I think there is quite vast commitment to bringing about society and community to the importance of mental health. I think the challenge is that at times with mental health related matters, they're very abstract. They're not as concrete as input, output, here's the benefit of being able to put this. They're not quite tangible for efforts to be placed towards them. They're internal experiences, and they're also diverse. And I think sometimes it is overwhelming to keep up with the diversity of mental health issues, that the tendency is to suspend them and to erase them as a priority, because there's this sense of wanting to foreground being overwhelmed by what it is to really appeal to supporting mental health. But in terms of the agency, it is one of those things that we have to continuously plead for, but also understand that the wheels might turn significantly relatively slower.
Okay, thank you so much for your response. I think we just take last question, and we will proceed to the next agenda. So last question from the audience.
Yes, I see that Olawi has a question. If you can unmute yourself and ask it yourself, or I can read it for you if you can't do that.
Okay, so if You have selected the person, right? So if you have done that, then kindly call out the person for me, the selected question, so that the person will do that.
Olawuyi.
Can we have that?
Okay, they're not here, I believe. So I will read the question. The question was, how efficient is the usage of digital tools in addressing mental illnesses or challenges? And Ola is from Nigeria.
Okay, I'll be giving this question to the founder of the Packet Coach, Ongo Pose. Please, sorry for mispronouncing your name. Anytime you want to speak, please mention your name so that we get used to it. Thank you. Please respond to the question. Are you there? Okay. I think we lost her. Okay, in her absence, can we have Grace? Is Grace with us?
We have issues
Okay.
with the network.
Thank you.
Hello?
Yeah, we can hear you. Please proceed.
Sorry, I have issues with my network band here. So, can you repeat that question? Sorry.
Okay. Miss Maria,
Hello?
please repeat the question.
Oh. Hello?
Yeah, we
Hello?
can hear you. We can hear you. We'll read the question for you.
How efficient is the usage of digital tools in addressing mental illnesses or challenges? Ola from Nigeria.
Please, under 1 minute, address that. Thank you.
Hello?
Yes, Grace, we can hear you loud and clear. Proceed.
So, kindly, I have issues with the network. If I'm breaking down, I refer to my fellow presenters. I beg pardon of the question.
Can you please type it just on the screen so that...
Yes, Ali, if you can answer it, the question is, how efficient are digital tools and for challenges with mental health?
How efficient are digital tools
in addressing mental illnesses or challenges?
in addressing mental? Okay. So great. If you are listening to us, the question is, how efficient are digital tools for addressing mental illness? So please, I think he has trouble with his network. In that case, Mr. Ali Salama, if you are online, please respond to the question under what. Do we have Mr. Ali? Oh my God. Edna, will you like to respond to that question?
Yes, I can do it.
Yes, under 1 minute. Thank you.
Digital tools, they are really useful. We have now a great movement in mental health applications, and like, since now everything we do is with our phones, our computers, why not take these to our favor? So if you have a mental health application, it's easy for people to get in touch with the kind of information they need, whether to have an initial idea of the mental health issues themselves or their loved ones is going through, so they can take as the next step by going to the mental health professional to seek appropriate help. So it is useful. It's being widely used and it works. I can vouch for it because I'm a user of mental health applications, and they are of greater help. We can use technology in our favor to spread even awareness on mental health topics. So yeah, it is really useful.
All right, all right. Thank you so much for your response. And thanks to our participants for making time for today's webinar, YALDA October 2021 webinar on mental health, care for all. Let's make this a reality. Thank you for your participation. Thank you. A big thank you to all the speakers for making time for today's event. We appreciate your time and your responses to the questions. I believe that the audience will take this up and also share what we have all learned today with our various networks. Thank you so much. And thanks to the IT department for
Hi, can the speakers just say their closing remarks, please? Thank you.
Yeah, so thank you, everyone. Have a nice day.
Thank you.
All right.
Hi, everyone. The meeting is over, so we can just slowly leave. Thank you all for joining, and I hope you have a great weekend.
All right. Thanks very much for hosting us. It's been really interesting and informative. My name is Joshua from Uganda. and it was great. Mary, Elizabeth, Lukamu, Moses, thanks for putting this together. I think that was beautiful.
Thank you so much, Joshua, and thank you for everyone who contributed to making this happen.